You have depression? अरे डिप्रेशन तो सबको होता है. Even I have gone through depression. There is so much stress in life, and you know, everyone has stress, everyone feels depressed from time to time. It's just a normal phase of life. You will snap out of it. Just take a break from work if you're not able to work. Go on a vacation. Why don't you start some healthy habits? Get up in the morning, do some yoga meditation, take a vacation, learn some new hobbies. You'll instantly feel better. You're having negative thoughts. So why don't you just think positively? Come on, snap out of it. You're always like this. It's so depressing to be with you. I'm getting depression from you. अरे हमारे ज़माने में डिप्रेशन कहाँ होता था? ये तो आजकल की मॉडर्न डिजीज़ है. आजकल के बच्चे ना स्ट्रेस हैंडल ही नहीं करना जानते हैं. प्रॉब्लम्स तो हमेशा थी, पर हम डिप्रेशन होके खुद से ही ठीक हो गए. हमारे पास चारा ही क्या था. आजकल मेडिसिन्स लेते हैं डिप्रेशन के लिए फॉर थॉट्स. जस्ट इट्स अ शॉर्टकट, यू नो, टेकिंग मेडिसिन्स. व्हाई वुड एनीवन टेक मेडिसिन्स फॉर समथिंग लाइक your own thoughts? Control it yourself. Get a hold of yourself. This is what people say when you tell them you have depression, or maybe this is a idea that you have about depression overall, and somewhere this is wrong. This does more harm to the person, and this kind of skewed perception of depression is more damaging because it stops a person from seeking the right help. They misunderstand it themselves and they feel guilty for having not able to be control themselves. So what is depression really? Why is it so misunderstood? And why is it so hard to understand? There is this flawed perception in our society that about what depression is. Now, according to most people, depression is a normal phase of life. What happens is that they confuse it with sadness. Depression is a word we use to describe sadness of mood. It is also a disorder, major depressive disorder or clinical depression. That is entirely different from sadness, but somehow people confuse the two. They think that major depression is sadness. So whenever someone says that I have been diagnosed with major depression, they understand that to be just they are having some sadness. What is the difference between the two is something we have to first clearly understand. Now, what people think about depression is that there should be three things in that. One is that there has to be a reason for depression, that something has to go wrong in a person's life. There has to be some sort of a loss. Maybe they have lost someone, maybe they have lost their job, they are going through some breakup, some stress, any financial stress. Number two, they feel that there should be some sort of a struggle period where the person is trying to cope up with this. And then number three, if a person's ability is not strong enough, or their mindset is not positive enough, or they are not having, say, a good lifestyle, they'll end up in depression. They are not able to handle that stress. It points to a person's inability to handle stress or some sort of weakness. This is what the normal general understanding of depression is, and this is completely wrong, right? I'll tell you why. This is a good model for sadness. This is a good model for normal life sadness that we get. All of us, we have experienced losses in life. We have experienced maybe loss of people, loss of relationships, loss of any opportunity, any job, something traumatic has happened to us. And of course, we'll feel very sad after that. We'll feel very low, we'll feel very down for a lot of days. We won't be able to function as well as usual. We won't be able to feel happy as well as usual. But after that, generally, we are able to gradually come back to normal, maybe by doing something new, by maybe picking up some new habit, by getting back, distracting ourselves with work, by again talking to our close ones, maybe taking even psychological help, and gradually it fades away. With time we get better. We generally don't need medicines for this, right? Because somewhere our brain, our mind is able to regulate our mood so that once you have this low mood, once you have this sadness, it gradually comes back to baseline as our focus shift on other things. Like they say, time heals everything, right? But not in major depression. So what is so major about this major depression that I'm talking about? For this, we have to understand one more thing. We don't view our mind and bodies in the same way. When we think of our mind, we think of ourselves. We think of it as an entity. We think of our moods, our thoughts, our personality, all in our control. And to an extent, this is right. But also, the mind is a product, is a function of our brain. And we are creating, of course, we think about ourselves and we have control over that. We have control over our moods. We have control over things we enjoy and what we want to do. But this is also regulated. This control is regulated through neurotransmitters. It is regulated through neuronal processes in our brain, through neuronal circuits. And as with the rest of the body, any of this can dysfunction. So even if we are trying to, sometimes it can dysfunction. Sometimes even if we are trying to feel good, we actually don't feel anything. We don't have the same thinking about other organs in our body. For example, let's take other organs like the liver or kidney or the heart. Now, we are not really aware that they are there. We know that they are there. We have been taught, I'm sure, in anatomy or in general, we have an idea that, okay, liver hai, ye kharab hota hai, this is what you should do. But we are not aware of what exactly is happening, or we don't feel that we are controlling it. As long as we are not doing anything to actively damage it, things are happening on its own. All the metabolizing, all the detoxification, all the heart pumping, all that is mostly happening on its own. So when we have a disease of it, we don't feel as responsible that we have done something, unless it's something caused to our lifestyle. Otherwise, if we have a different disease, we just feel sad. Of course, we'll feel bad, but we don't feel as responsible for it, and we generally go to the doctor and we take the treatment because we understand we can't really treat it ourselves. The same is not the case with the mind. We feel that because we have control over our thoughts, because we think, we are able to think, we are aware of our thoughts, we are aware of our mood, so we should be able to control it completely. And whenever something is wrong in our thinking, that we only have to be able to solve. And if we are taking outside help or any kind of help for it, so it implies some sort of weakness on our part in some way. Why this is wrong, I'll tell you. Okay. Like I said, that those chemicals and those neurons which are responsible for the circuits in our brain, if they dysfunction, we are not able to do anything. Suppose you know how to use your microwave, right? But what happens, and you know what to switch it on, what to do in it, but what happens when the plug is not working, or the wire is not working of the microwave, it's not getting current, you can't use it, right? Similarly, in your brain also, we have a lot of different chemicals, a lot of different neurotransmitters. Some of the important ones that have been implicated in the past are dopamine, serotonin, norepinephrine, GABA, glutamate. So these are basically chemicals which are messengers. So there are neurons in our brain. You can think of the brain as circuit of many neurons. Okay, and between these neurons there are these chemicals which release them, and they carry the signal from one neuron to another. Now suppose there is a deficiency in any of these chemicals, or an excess, or these circuits are somehow not working. Okay, so even if you tell yourself positive thoughts, even if you do positive activities, it will not work. Let's take the example of dopamine. Okay, it is one of the chemicals I think is somewhat well known. It's we get a dopamine kick, right? It is the reward hormone. It is the reward neurotransmitter. Whenever you do something good, anything pleasurable, you eat something nice, you watch something nice on TV, you do any good task, you have any good time, you feel good. And this feeling good is because there's something in the reward center of our brain, that's a part of our brain that deals with rewards, where there's a spike of dopamine, where there's an increase in dopamine, and that is why you feel good at that time. And all of that good feeling of well-being rushing through your body is somewhat due to the reward function center being activated. Now imagine you are starting to feel bad about yourself, about you are having negative thoughts, you are not having much of interest in anything, that is, you are starting to have clinical depression. Now, what is the first thing you do? You will start doing things that bring you joy. For example, suppose in your case you like to paint, say, and you think that okay, let me paint and then that will bring me joy, so I'll snap out of it, as my friends have told me. You try doing this and your reward center is not working, your dopamine circuit is not working, and now nothing clicks. You are trying to paint, you're trying to focus on it. Number one, you're not able to pay attention to the task. Number two, there is no joy after the task, there is no motivation to do the task, there is no energy to do the task, and even after you have done it, you feel nothing. So what do you conclude? That I don't like doing this anymore, I don't want to do this anymore, I can't do this anymore. And it's not as simple as staying disciplined or keeping on doing it, because you have 100 other thoughts as to why am I feeling this way? Why don't I enjoy this anymore? Something is wrong with me. I'm losing my mind. I'm losing myself. This is how a person with depression feels. It's not sadness. We have all known sadness. It's not as simple as that. A person with depression, with clinical depression, generally feels nothing. They will feel no emotion. Even sadness is an emotion. They might not even feel that. Or they might feel sad, they might feel anxious, they might feel like crying, they might feel guilt. So it's an overabundance of negative emotions coupled with low energy, coupled with a lack of motivation in doing anything, coupled with slowing of cognitive processes. That means a lack of attention, lack of focus, lack of memory. They feel that their minds are becoming slower, they are not able to work as much. They start having feelings in their body as though their arms are feeling heavier, their legs are feeling heavier, they don't feel any appetite, they are not able to digest their food, they are not able to sleep. And this is happening because it's a biological disease. It's not in their control. It's not a choice. It's not the intent of the person. It's not about the strength of the person. Any person can get depression, and whether you have a positive mindset, whether you have a negative mindset, none of that matters then. What matters then is that this is a disorder. It has to be recognized. It has to be treated. There is treatment available. But it is to stigmatize the idea of taking treatment itself because of how it is portrayed by society, that it becomes difficult for the person to take the first step. And that is what my purpose here is, to make you aware that it's not that difficult, it's just what people portray it to be because there is a lack of awareness. So if anyone approaches you that they have depression, they feel depressed, or if you are feeling any of this, don't listen to any of the advice that people give you. Normal people are not experts in this. Even I, before I did my psychiatry residency, I did not know this much about this. Now I know because I have been practicing as a psychiatrist for many years. And this is what I can say after my years of experience. So don't let a non-expert tell you about this, because unless a person has experienced depression or seen it in someone close to them or has worked with people who have depression, they will not understand. I hope this video clarified somewhat on why depression is so misunderstood and how a person with depression really feels. I'm Dr. Ananya Dhar. I'm a consultant psychiatrist. Thank you so much for watching this video. If you enjoy my videos, please subscribe to our channel.